I'd like to talk about the importance of access to reliable transportation for Medicaid beneficiaries. As you said in your testimony, Mr. Riccardi, this benefit can be a lifeline for Medicaid beneficiaries who may not be able to afford other means of transportation. I think it's just common sense. If you can't get to your doctor, it doesn't matter if you have health insurance or not. Mr. Riccardi, I'd like to ask you a few questions about the folks who rely on this benefit and what sort of treatments they're using it for and what they're trying to get to with this transportation. First, Mr. Riccardi, just to clarify, when we talk about non-emergency medical transportation, otherwise known as NEMT, we're talking about rides to healthcare providers, pharmacies and that sort of thing, not trips in an ambulance or to the ER. And so can you clarify what kind of access these people are getting when they utilize this transportation?
Yes, the NEMT benefit is a key Medicaid benefit that helps the most vulnerable Medicaid enrollees access medical services. This is not emergency care, say ambulance rides to a hospital, but for medical visits. And these people are any combination of elderly, have a disability, and very low income, and have no other means of transportation. And so this benefit allows people to receive both preventive care and a number of type of services. Many of our clients are receiving this benefit, are using it for dialysis treatment, and also for behavioral health and substance abuse disorder treatment and medical services. I can think of one client who is unable to leave her home, and without this benefit, she would not be able to receive her medical treatment. And she needs some assistance in leaving the home, and this benefit is crucial for her to get to her medical appointments. And in many cases, people who are using this benefit are women and they're elderly and unable to drive or transport themselves. And this is why this benefit is so important.
Thank you. And to clarify, and this is a benefit that benefits people in rural and inner city communities pretty much equally, right? It doesn't discriminate.
Yeah, and so individuals in rural communities can access this benefit. And what's unique about this transportation benefit is our helpline is available for people with Medicare and Medicaid who call us with questions and issues. And so many of the people that we speak to who are accessing this benefit are not calling us with complaints about NEMT. They're calling us with other Medicare-related questions. But we hear about the chronic conditions they have and how this transportation benefit allows them to receive the services that they need. And the majority of our clients are receiving dialysis. And what's great about this benefit, and I know this states have flexibility with this benefit, they're able to access this service 24 hours a day, and it really is a lifeline for them. Otherwise, if this benefit did not exist, people would not be able to stay and live independently and in the community.
And also, I would venture to say, and I'll go on to my next question, that without this benefit, the cost expense would exacerbate for the individual and for our system. Mr. Riccardi, according to the Medicaid and CHIP Payment and Access Commission, about 42% of the people who use the NEMT benefit are dual eligibles, meaning they're eligible for both Medicare and Medicaid. In your testimony, you said that these dual eligible individuals often have complex medical needs. That's 60% have multiple chronic conditions and 41% have at least one mental health diagnosis. Is it fair to say that these individuals likely need a significant amount of Medical care throughout the year?
So yes, on average, someone who's dually eligible for Medicare and Medicaid can have anywhere from 4 to 5 chronic conditions, and additionally, at least one behavioral health issue, and increasingly more and more older adults are suffering from anxiety and depression. And so this benefit truly is crucial for people who are either elderly or disabled and low income, where they're unable to afford transportation. So this really enables for them to receive their services and then also prevent either relapses or a worsening of a chronic condition.
Okay. Thank you very much, and I yield back the balance of my time.